So this treatment is called cryotherapy, cryolipolysis, well known in the aesthetic industry as fat freezing. And this treatment is generally for people who have targeted areas of fat that they are struggling to lose, tightening skin, cellulite, removal of cellulite. This treatment can also be used for sports injuries, muscle injuries, used by our physiotherapists here. But generally it's for everybody. It's not going to overly remove all the fat that you have in your body. It is targeted areas that we use it on. So generally for targeted areas of stubborn fat that people are struggling to remove, or if you have areas of uneven tone skin and you want to tighten up skin, or you want to remove any cellulite, these kind of patients would benefit from. Initially you would come into the clinic here and we would do initial consultation. We usually take measurements, we'll take some photos just as a guide as we're going along with the treatment, so we can do a comparison as we go along. First treatment, well, all treatments generally take, you'd be in and out in about half an hour. It's a very quick treatment. You could pop in and have it in your lunch hour when you finish work. There are no downtime, the skin is obviously cold to touch, there's a bit of redness afterwards, but it's a very safe device to use. Roughly you would need to have 4 to 5 treatments with a week in between each treatment to get to the best results. We've got a client in today that we're going to do some fat freezing on. She's got some stubborn pocket areas of fats, mainly on her inner thigh and her upper knee. Here is a frontal image of the upper thighs, where you can see she has quite a lot of pitted skin. She's got a lot of excess skin. There's not a huge amount of fat there, it is generally more skin. There's a bit of cellulite there, and using the cryotherapy we hope to tighten everything up here. From the inner side of the thigh you can see quite a lot of loose skin here in the before photo. Using 4 to 5 sessions of cryotherapy we're hoping to tighten up this skin on the inner thigh. The opposite side, again inner thigh on patient, where we're going to use cryotherapy to try and tighten the skin in this area and even out the tone and texture of your skin, removing any of the cellulite. So this device here is going to cool the skin down between 0 and 4 degrees, and what that does is destroy some of the stubborn fat cells but protects any of the outer tissue. The patient's immune system then will kick in and take away the destroyed fat cells. It will also tighten skin in that area, helps reduce cellulite. It's a very quick and easy treatment, in and out for a couple of minutes, and you need to repeat this treatment every week for around 4 to 5 weeks. Okay, as you can see here we are spraying the skin with the applicator gun for the CO2 cryotherapy, and it's pleasant enough for the patient. You can see the skin is turning slightly blue light, with the indicator turning blue. This tells us that we're at the right temperature. It's very short, quick for the patient. We're doing about 7 to 8 minutes in general for our inner thigh to try and tighten the skin around this area and remove any sort of difficult fat deposits that are there. She's coping absolutely fine with this, and we're spraying on the other side here. Patient is perfectly comfortable. A short treatment. The skin is coming down to the temperature that we want, and we can see that by the blue light that's in place there, indicating that we're on the right temperature for freezing fat cells and skin tightening. Again, we're spraying here to just cool the skin down. It's a perfectly pleasant enough treatment. The blue light again is indicating to us that we are at the right temperature for freezing fat cells and tightening the skin. We'll also reduce any of the cellulite inside the leg here, and we'll repeat this treatment next week. If you want a consultation, you want to consider this treatment, give us a call at the clinic, send us an email or reach us through our Facebook page.